Thank you. Okay. I'd like to welcome everyone to our webinar this afternoon on effective communication with your healthcare team. A very important topic, and so we are so happy that you joined us. We will also have this program recorded, so you will be able to see the slides and the recording in about a week to be able to look at it a second time as well as to share it with other people. Your lines are muted and will be muted throughout the program, and you can type questions or comments in the chat box, and any questions we will address at the end of the program. And it is now my pleasure to introduce Dr. Stacy Ogbeide, who is a board-certified clinical health psychologist and a board-certified specialist in obesity and weight management. She's the Director of Behavioral Health Education in the Family Medicine Residency and Associate Professor with the Department of Family and Community Medicine at UT Health San Antonio. She also has a cross appointment in the Department of Psychiatry and Behavioral Sciences, and she serves as the primary care track coordinator for the Clinical Psychology Internship Program. Dr. Ogbeide serves as a consultant for the Integrated Healthcare Initiative of Mental Health America of Greater Houston, which focuses on engaging and increasing the delivery of integrated health services in Greater Houston and throughout the state of Texas. She's the 2019 recipient of the Association for Psychologists in Academic Health Centers Early Career Psychological Contributions Award, the 2019 recipient of the Integrated Care Champion Award of the Missouri Psychological Association, and the 2020 recipient of the Excellence in Clinical Health Psychology by an Early Career Professional Award through the Society of Health Psychology Division 38 APA. She was recently awarded the 2021 Healthcare Hero Outstanding Educator Award through the San Antonio Business Journal. Currently serves on the board of directors for the Collaborative Family Healthcare Association, and she has published in primary care and behavioral medicine, has over 135 conference presentations, and teaches doctoral courses in behavioral medicine and primary care behavioral health at Our Lady of the Lake University, which is in San Antonio, Texas, and graduate level courses at the University of Texas, San Antonio. Dr. Ogbeide's professional interests include the primary care behavioral health consultation model, behavioral medicine, health psychology, faculty development and mentorship, and primary care workforce development. Dr. Ogbeide's work has been featured on Texas Public Radio and the San Antonio Express News and in other news media outlets. And on top of all that, she is also, I'm so happy to be able to say this, a member of our DPC Education Center's Advisory Council. Very good, very busy woman who has been a real tribute to our organization, and I think that you will find there are many things to learn today from her. Dr. Ogbeide, I will turn the program over to you at this point.
Perfect. Thank you. Thank you so much. I appreciate that. Well, welcome, everyone. I'm so glad that you are here, and my hope is that this information today you will find valuable as you navigate through your healthcare appointment. So we'll be talking about how to have effective communication with your healthcare team, something that I hear patients share with me all the time about feeling as though their team maybe is misunderstanding them. They feel they're not being heard in their healthcare appointments. And so I wanted to at least give you all some help with that to hopefully help you have much more effective healthcare appointments in the near future. So get a paper and pencil nearby so you can write some of these things down. If you can see the slides, fantastic. If you can't, fantastic too. I'll make sure and be as thorough as possible when going through this information. And of course, there is a chat box if you are in a place where you can use the chat box. So feel free to type in any questions, comments that you may have about anything that I am sharing today. And I will make sure we have time towards the end of the talk today to address any questions that you have or anything you'd like me to clarify for you. All right, so let's get started here. So first and foremost, thank you so much for having me, the DPC Education Center. I've been very fortunate to be a part of this group for a few years now, and I'm just excited to share what I know as well as I'm always thankful to learn from you all as well. So I just wanted to first say thank you for having me back for another webinar. So our goals for today, a few things. We'll talk about why it's really important to have effective communication with your healthcare team. You could probably tell me yourselves lots of the reasons why it's important to have this, but we'll talk about that. We'll talk about things that possibly get in the way, some barriers to having effective communication, and then we'll go through some specific skills that you can use hopefully at your next healthcare appointment. All right, so let's keep going here. So has this ever been you? I have some thought bubbles coming up on the screen. And this is a family at a healthcare visit, and the thought bubble, the first one says, what are they talking about? The next thought bubble says, I'm not sure what to ask. There's another thought bubble that says, I still have so many questions. So I would be curious to hear, has this ever been you at your healthcare visit where you feel a little bit disconnected? The visit isn't making sense. The plan doesn't make sense. I know that I've experienced this in my own healthcare journey, and so I always wonder if other people experience this too. I hear this all the time from patients, but I wanted to at least bring it to the center here because this is a common experience that a lot of individuals go through at their healthcare visits, especially when having kidney disease at any stage. You may have a lot of different healthcare providers and a lot of different healthcare visits, and sometimes it can be hard to keep track of, okay, this provider said this, and then I have this other provider who's saying this thing, and it doesn't make sense, and it's not consistent with what then this third provider just told me, so it can be difficult sometimes to keep track of everything that is being said at your healthcare appointment. So if this has been you, no worries, you are in luck. Our hope for today is to give you some tools to help when you do have these questions that show up. So why is this important to communicate with your healthcare team? I have a few things here, but if you think of other things, please type them in the chat box. I'd love to see what other people have to say. But what we know is that really good communication, we know that patients are much more satisfied with their health care. That is huge. People feel they're getting something out of their health care. Patients are able to follow their health plans more consistently. You can imagine if you have a better idea of what your healthcare team would like, it makes sense that you'd be able to follow through with some of the asks that their team is bringing up to your attention. And then, of course, if you're able to follow through on your health plan, patients are more healthy when they're able to communicate well with their healthcare team. Of course, that's what we hopefully can all hope for at the end of the day, is just to have a good quality of life and do the things that are important to us and that we find value in. And so being able to do that is really important. And lastly here, as I mentioned before, patients with chronic kidney disease, or regardless of the stage of kidney disease that you have a lot of contact with your healthcare team. You may have a lot of different healthcare providers. You may be going to dialysis. You might be getting lab work. So you're interfacing with the healthcare system a lot, and that can be stressful. And so feeling as though you can't communicate well with anybody on your healthcare team, as one can imagine, can be pretty overwhelming. So Lots of really good reasons why we're having this talk today to help you just feel more confident in the type of health care that you are receiving and that you deserve. So what gets in the way of good communication? I have a few examples on the slide here, but again, if you have other ideas, you are welcome to share them in the chat box as well. But one of them is not being an active participant on your healthcare team, feeling as though you don't have a voice. I hear that sometimes from patients that they may feel as though they can't speak up or it's not their place to speak up. We know that that is far from the truth. This is your healthcare, and so you are there to speak up and ask for what you would like, or if you just have questions about something, that it's completely okay to ask questions because it's your healthcare. So not being an active participant. And the next thing is, as I mentioned before, not feeling comfortable asking questions to your healthcare providers. Sometimes that may seem as, am I being too pushy? Maybe it's not consistent with how your upbringing. Maybe in your upbringing you were taught to just do whatever the healthcare provider says and don't ask questions. But times have changed. Times have changed, and we want you to ask questions so we don't fall into this trap of having not so great communication. The next thing here for some individuals, maybe English is your second or third or fourth language, and so language barriers are huge and can possibly get in the way of you explaining your needs well to your healthcare team. And then why hopefully everybody is here is having the skills. I hear from many patients saying, well, I want to share this, I just don't even know how to even bring this up in my healthcare appointment. I don't know where to start. I don't know how to ask for this. And so sometimes people may feel at a loss of, I don't really know where to go next with how to ask for this. I hear in the chat, see in the chat box, someone mentioned time constraints. Oh, that is huge, especially if you maybe have experience with a certain healthcare provider and you know that, okay, I'm going to get 7 minutes in this visit before they walk out. And so how do you maximize your time when you know that you may not have a lot of time with this healthcare provider in your visit? So thank you for sharing that in the chat box. If you think of anything else, feel free to type it in, and I'll read it out loud to the group so everybody can see what's going on. So how do you know if the communication with your healthcare team right now is working or not working? So some ways to know that you may need to figure out how can we improve the communication with your healthcare team. If you ever leave your healthcare provider's office and you still have a lot of questions or concerns, does that ever happen to anybody? You can just tell me yes or no in the chat box, but have you ever left your healthcare appointment and thought, wait, I have more questions than I started with now. I'm so confused. So that's maybe a sign that there's something going on with communication. I see people saying, I see lots of yeses. I see absolutely. Thank you for sharing that. The next thing here, you feel there's never enough time to discuss questions or concerns with your healthcare team. Do you feel that the end of the visit is maybe rushed, where maybe you thought, okay, I'm going to ask the question today, I'm going to do it, and you're in the waiting room thinking, okay, I'm going to ask the question, and then you get in there, and then you blank because you're feeling rushed, and then the question just totally leaves your mind, and you're like, oh, well, now I don't remember what my question was. Has that ever happened to people? I'm seeing lots of yeses in the chat box, so there's definitely some shared experiences happening here. And then the last part that I have here, you feel that the healthcare team members are not open to discussing your questions or concerns. And that can be tough, where you feel that maybe you have brought it up and you feel that just people aren't listening, or that there's just something happening where you're not feeling heard. So has that ever happened to someone where maybe you do say something and nothing really changes. You're like, okay, I mentioned I didn't want to take this medication anymore, and it's still on my med list. So yeah, somebody put in the chat box feeling really dismissed. That's so difficult to deal with when you really have something you want to share, and you feel kind of like someone said, dismissed, kind of put aside of, well, okay, I guess maybe they didn't think this was as important as I thought it was. So that can definitely feel very overwhelming and frustrating too when you feel you're not feeling heard. Thank you for sharing. Thank you for sharing all of that. So what can we do? Okay, so I want to spend the rest of our time talking about some things that we know from past experiences, past research that we know really helps with being effective, having effective communication in your healthcare visits. And again, if people have tried any of the skills that I'm going to mention, type it in the chat box. Let me know, hey, I've tried that, it worked great, or hey, I tried that, if it didn't work great. Let us know your experience with anything if you've tried some of these things before. All right, so let's keep going. So the biggest things that I'll be focusing on are 4 different things to help you build your confidence in taking action on your health care. At the end of the day, it's your care, and we want you to be an active participant in your health care. It's no one else's care but yours. You are important, and so we want to make sure that you feel that your voice is heard and valued during your healthcare visit. So we'll talk about something called record sharing. We'll talk about something called patient question lists. We'll go over something called feed forward, and then I'll end with talking about something called coached care. So these are the 4 things we'll talk about today. So let's first talk about record sharing. So not too long ago, in the past year or so, there's actually been some national or federal guidelines to where your records can be shared. You have complete access to see your medical records. So if you didn't know that, hopefully now you know that you have access to see what any of your healthcare providers are writing in your medical record. And so if you want to see that, it's there for you. This is really important because it helps with a few things. It helps you better understand what's going on with your chronic kidney disease, your dialysis. If you have questions or maybe forgot something that was discussed in your visit, you can actually go back into your medical record and see, okay, well, let me see what was actually in the plan so I can remember any of the changes that the healthcare provider recommended. So that's one thing. Number 2, it helps you feel much more in control of your own healthcare because you have access to these records at your fingertips. If anything is incorrect in your chart, you can definitely reach out to your medical team to correct it. I get messages from patients often where they say, you know, I'm not taking that medication anymore, but they still have it on my med list. Could my healthcare provider take that off my list? We're like, absolutely. So it's a great way for you to understand what's in your medical record, and is it accurate or is it not accurate? So again, this is really helpful when you have a lot of visits to different healthcare providers. So again, as we mentioned earlier, with dealing with issues related to kidney disease and dialysis, you might have a lot of different healthcare providers. So understanding and being able to see your medical record is huge. And so the next time you go to your healthcare provider visit, if you haven't said yes to, I want to be able to get a username and a password to log in electronically from home or from wherever to see your medical record, be sure to ask for that so you have access to see what's in your medical record. So something to think about. Has anybody done that? I see people talking about the patient portal in the chat box. It looks like someone says, I use patient portals all the time. Fantastic. Someone says they are lifesavers. Wonderful, wonderful. So we have some people who are definitely advocating for the patient portal. So if you're on the fence, just know that you have some support here in this webinar letting you know that they highly encourage you to consider doing that. If you would describe yourself as not being technologically savvy or saying, you know, I'm not great with computers or the internet, many healthcare systems will actually provide you with someone to help you and show you how to log into your patient portal, how to look through the charts. So you can ask for help if you are maybe nervous about computers or getting on the internet. So ask for that if that's something that's on your mind or maybe keeping you from trying out the patient portal. So thank you all for sharing your experiences with the patient portal. Fantastic. All right. Other things you could use with the patient portal. Getting in touch with your healthcare providers. I don't know about you, but have you ever tried to call your clinic and possibly been on hold for 30 minutes? It's pretty painful. Sometimes clinics are really, really full and very, very busy. And so sometimes answering the phones are not always prioritized, unfortunately. But with the portal, you have an option to actually send your healthcare team messages. You can send them questions, especially if you see a provider once every 3 to 6 months. We really wouldn't want you to wait 6 months to ask your question because you might forget. Versus, you know, I'm not coming in for another 5 months or 6 months, but I have a question about, you know, I saw this medication through a commercial, and I'm curious if this would be appropriate for me or not. And then your team has a chance to log in, see your message, and then give some time to respond. Usually with portals, we say give your team about a week minimum to respond. Sometimes it can take 1 to 2 weeks, especially these are questions that are not an emergency. These are just questions of I have a question about this medication or what this lab value means. Can someone write me back or call me back at a future time? So keep that in mind that if you do message your clinic team, it could take 1 to 2 weeks to get a reply back. So this is not something for emergencies. If you have an emergency, don't use the portal for emergencies. Reach out to your medical team, contact your nearest emergency room. If it's something that is really pressing, please, please, please don't use the portal. We want you to call your clinic or go to the nearest urgent care emergency room for something that needs an answer very, very soon. And if you're not sure if it's an emergency or not, many healthcare systems have something called a nurse line where you can actually speak with a registered nurse over the phone, and they can help you figure out, is this an emergency or is this something that I could wait for a little bit. I'm looking at the chat box. People are talking about using the portal because, yes, phone calls can often go unanswered. So again, you have people sharing in the chat box that they definitely have used the portals for many different things. So this is one great option to think about having better communication with your healthcare team. The next one is one of my favorite things. It's called Patient Question List. And this is something that you do at home before the visit, especially if you feel rushed in any of your visits, if you feel there's just not enough time in your visit, or maybe there is time and you just forget. You forget your questions. We're all human. We're not here to be perfect, but maybe you forget your question. Using the patient question list is amazing. So essentially what you're doing is at home, you are writing down any questions that you have, anywhere from 1 to 3 questions. You don't need to bring a list of 15 questions to get addressed, but anywhere from 1 to 3 questions that are your most pressing or something that doesn't make sense to you with your healthcare plan. Do those at home. You can ask a loved one, a friend, a family member to help you with those if you would like help with that. And then you then can bring those questions to your next healthcare visit. I always encourage patients when you are getting roomed by the medical assistant or by the nurse to let them know, hey, I have a few questions I have for my healthcare provider, just so they can prepare the provider of, let's talk about that first, so that way we don't have it missed if we wait till the end and then we run out of time, and then we're not able to address the questions that you have. So writing them down ahead of time. I have here, one to three or 2 to 4 questions to come up with to discuss. Understanding that you may not get every single question addressed, but even if it's just one question from the list, that is a start to improve that communication with your healthcare team. If you're not sure, I don't even know where to start, I don't know what questions to ask, I do have 2 questions on the screen here that I would encourage you to think about asking. The first question says, what is one thing I want to tell my healthcare provider or my healthcare team today? So that's something you can think about and then see what you can come up with. The second question is, what is one thing I want to ask my healthcare provider or team today? So again, if you're not sure where to start, these 2 questions are a great way to begin to help you think about, well, what would I even bring up to my healthcare team? I'd love to see in the chat box, has anybody tried patient question lists before? And what was your experience with using the list? I'd love to see what people have done, or maybe not. Maybe this might be new for some of you as well. Someone says yes, that it is great. So glad to hear that. Anyone else? Anyone else try the patient question list? Someone says yes, keeps you organized. I love that. Someone says yes, it helps a lot. Someone says it's kind of like going to the grocery store. It helps when you have a list so you won't forget. Oh, I love that. That is fantastic, fantastic, fantastic. Someone says yes, they use it for their family, especially if they're taking other people to medical appointments. And then someone says that's the only way I get all my concerns addressed with all the healthcare providers. So again, you have lots of people saying thumbs up to you for using this. So if you haven't tried this, think about it. You have lots of people telling you in the chat box they had a really good experience with the question list. Fantastic. Wonderful. The next thing is something called feed forward. So it's a fancy word for patient satisfaction surveys. We all get them, and I know they can be a little bit annoying when you get the email or you get the text after your healthcare visit, or you get some clinics may call you, can you do this survey over the phone, and then maybe the last thing you're thinking is, oh, I don't have time to do this survey, I don't want to fill it out. If you get those surveys, please, please, please consider filling them out, because this is how your healthcare clinic or your healthcare team or your hospital, they use that information to inform how they practice. They give that feedback back to the healthcare provider, to the healthcare clinic, to the team, and we look at those and we use those to improve, okay, patients are saying that I'm not giving them time to share their questions. Okay, got it. I'm going to make sure I do that. So it's actually very, very helpful for you to fill those out to inform the healthcare team to do better with how they communicate with you. So I hear from many of my patients, they say, oh, I don't fill those out. And I understand. I understand life is full. We have lots on our plates. But if you can give 5 minutes to a survey the next time you get it, it's a fantastic way to give your healthcare team feedback, especially if they're doing some things that you feel could be better or could be different, or if they're doing something that you absolutely love, tell them so they can keep doing that for you. I think sometimes with surveys we only give the feedback of, well, I don't like this, I don't like this, I don't like this. But sometimes we forget to tell people, but I love this, and I love this, and I love this. So your clinics know, okay, people love that we offer this, so let's keep doing that for them. Or the same medical assistant that always rooms me when I get there, is always so kind to me. I just want to let them know that so-and-so is just always so kind no matter what's going on in clinic, whether they're busy, slow, they're always kind to me. Tell your clinic that so they can know and keep doing those things. So I see people typing in the chat box, yes, I fill out the surveys. Awesome. It's a great way to have your voice be heard. Someone says they still get the dialysis surveys from CMS even though they've had to transplant. Fantastic. So yes, it's another way to give back and help your team better communicate with you. So thank you for those who have shared that so far. And then the last program that I want to talk to you about is something called Coached Care. This is something that some healthcare systems offer, and so if you're not sure if your healthcare team provides this, the best thing to do is to ask at your next healthcare visit if that's something that they offer. But this is really great if you would like more coaching, more teaching on how can I be more active in my healthcare plan. These are programs that can help you be more assertive with your healthcare. Maybe if you have some difficult interactions with a healthcare provider, you're like, I really want to figure out how to have better interactions with the healthcare team. They can help you with that, and they can just get you more involved in the treatment decisions that your healthcare team is making. So again, where to find this? Your healthcare system, of course. If you have a health insurance provider, many health insurance providers also offer this program to their members. So Coached Care is fantastic. Some places call them patient advisory boards. Like we call ours the Patient Family Advisory Committee. Some of them are committees where you meet with other patients from your healthcare clinic, team, system, and it's a way for people to give feedback to the team about how to do things differently, better, to change how things are communicated to patients in the system, and then you get feedback to help yourself as well be even more of an active individual in your healthcare plan. So Coached Care is fantastic. These programs are free. These committees are free. If you have the time or interest to give back to your healthcare team, this is another awesome way to do that. So if you've not looked into this before, take a look. If your system has Coached Care or patient satisfaction advisory groups or patient family advisory committees, every system calls it something different. And so it's just figuring out what your healthcare clinic or healthcare system calls it. But I think from my experience, we always love patient feedback from those groups of how we can perform what we do better. And so I'm very confident that your healthcare system would love to hear from each and every one of you about how to do better for you all, because it's really important that we do that. So thank you. I see in the chat box people are saying they're going to look into that. Someone says mentoring helps too. Absolutely, absolutely. Someone says they're going to look into these things. Someone also mentioned these are great for helping when there's maybe limited health literacy or just maybe limited literacy period, or if English is not the individual's first language. These programs can help to make sure that the communication is being addressed in an effective way so people are heard and understood and they understand exactly what's going on in their healthcare. So I'm so glad to see people are interested in checking this out and seeing if it's something that you'd be interested in. All right. So as we draw to a close, I want to at least give you some parting words to think about as we finish up for today. I think it's important to mention, and I saw somebody mention this in the chat box, which I love that you mentioned this, is that everybody has a different communication style. We all do, and you probably know this, but I think it's still important to mention, is that if you find that this is happening to you in your healthcare visits, you have every right to bring it up with your healthcare provider, especially if you feel that you've brought up your concerns, nothing's changed, you've brought it up again, nothing's being addressed. If you do that over and over again, you do not have to stay with the same healthcare provider. Someone mentioned earlier in the chat that they ended up switching providers because it just served them better. You have every right to do that. I understand that if in certain areas of the country where maybe you might be in a more rural area, or maybe there's fewer kidney specialists where you are, and you have fewer options. I know that can be harder to do, and so I would definitely consider the pros and cons of switching a provider. If you have that option and you feel it's the best option for you, please do that. If you don't have that option, let's consider pros and cons of, okay, I have these other tools that I've learned today about how I could possibly improve communication with this healthcare provider. Let me try out some of these other things to see if that helps you, especially if you're in a situation where maybe the next kidney specialist is 250 miles away from you, and switching providers is not an option for you. But I at least want to let you know that if it is, you have every right to do that. I don't think us as healthcare providers say that enough, that you have every right. We want you to feel comfortable. We want you to feel that you can communicate well with your healthcare team. As we've learned today, it is so important for you to have good communication with your healthcare team because it matters in your overall health. And we want you all to stay healthy, stay active as much as you can in your life. So again, if it's not getting better, if you have that option, you definitely should think about if you want to switch to a different healthcare provider. So I always like to mention that to kind of give people permission that it's okay if that happens. If you need to do that, please do that because we want you to feel comfortable. Because again, with kidney disease, you have a lot of healthcare appointments, and the last thing we want is to feel even more stressed because maybe the way the communication is going with the healthcare provider is maybe not optimal and not going as well as you would like. And so we want to make sure that you're getting what you need out of your healthcare visits. Okay, so which ones will you try out? I'd love to hear in the chat box. Is there anything that is sticking out to people that they're thinking, I think I might try this one first? Or maybe there's one that you're thinking, I'm already doing this one, so I'm going to maybe look into this one next. But what do people think? Is there anything that you're leaning towards that you say, is it the record sharing, getting on the patient portal? Is it the patient list? Is that what you're looking towards? Is it the feedback, filling out the patient surveys? Is it the coached care? What are people thinking? I see people typing here. Let's see. Coach, I see people saying coached care. Someone saying the patient list and coached care. I love all of this. Someone's looking at the making a list, coached care. And even if for those of you who are in a place where maybe you can't type into the chat box, I'd love for you to write it on your scratch piece of paper. Which one do you think you want to try from the 4 that we shared today? And you can write that down, share it with a family member, share it with a friend, someone that is supportive, someone in your life that maybe goes with you to your healthcare appointments that can encourage you to try out this new skill. But I love that people are sharing the different ones that they may try, which is great. I'm so glad to hear that. All right, so once you pick one that you want to try, which we have some folks ready to try a few different ones, which is fantastic, we encourage you to try different ones. If you haven't tried certain ones, see which one you like best. Maybe you find that I really love the list and I'm going to join the portal. Or I want to see if my clinic has a coached care program. Try different ones and maybe see which one works best for you. You might be surprised. You might find one that you may think, I didn't realize I like this as much as I do. And so that's one way. When you're trying something new, we always encourage you to walk it through, talk it through with family and friends, anybody who's supportive in your life. Practice with them. Especially trying something new can be a little nerve-wracking. It can be a little stressful. And so practice with someone who you see as supportive in your life to try some of these new approaches out. And then remember, practice makes permanent. It does not make perfect. We're not striving for perfection here. We just really want you to choose something that works best for you so you can have the type of communication for you that helps you be more active in your healthcare and just be an overall that healthy person that you want to be, need to be, to do the things in life that you want to do. And so that's really the big takeaway from this, is being able to try something new out, see what works best for you, and then if it does, keep doing it. And so these are the big takeaways that I wanted to bring to your attention. So just to wrap things up, again, communication with your healthcare team is so, so important. We've learned that it impacts your health and your satisfaction with your care. And what we've learned today from people sharing is that is very much the case. And so communication is so important. Communication is ongoing. This is a thing that never has an end. As your health changes, especially with having kidney disease, maybe new discussions need to happen. Maybe a new healthcare team member needs to be brought in. Maybe you used to see the nutritionist, but you haven't seen them in a few years, but something has changed with your health. And so you might be thinking, maybe I need to bring back working with a nutritionist again to see if I can make some changes. And so things change. And so as things change, communicate that with your healthcare team. Ask for what you need or what you think you might need because that's bound to happen. We expect changes to happen. And so as it changes, we can communicate those needs with your healthcare team. And then communication happens from the moment that you are diagnosed and should continue throughout your treatment. And so it's not, okay, I've communicated that one time and that's it. As we mentioned before, it's an ongoing process with really no end. As long as you are a patient in a healthcare team, that communication should be ongoing. So I wanted to share that with you to keep that in the back of your mind as you go through all of your own healthcare journeys. I do have some resources I want to share with you. If you can see the screen, there are 2 QR codes on the screen. If you're not familiar with what a QR code is, you will quickly learn what this is. You take your cell phone and pull up your camera. Don't take a picture, but just hover the camera over each code, and a website should pop up on your cell phone, and it'll take you to some resources online. If you want to dig into anything I talked about in more detail, there's some free resources available to you online. If you cannot see the screen, or if you're thinking, I don't know how to do this QR code thing, it's not working on my phone, that is okay. These slides and these web resources will be available on the DPC Education website. And so feel free after this webinar to go back to the website, click on this webinar, and you'll find the resources on the resource page there for you. But the first website gives you some more communication strategies after you're first diagnosed with kidney disease or really any chronic health condition. And then if you need help coming up with questions to ask your healthcare team, the second website gives you some sample questions, some ideas of where to start. If you are choosing the patient list option, it gives you some sample questions to ask your healthcare team at your next healthcare appointment. So really good resources. They're all free. And so I wanted to share that with you so you know where to go if you'd like some more information to continue on your learning journey. If you are a reader, you can type in the chat box, tell me yes or no if you like to read books. Not everybody does, but some people do. If you do like to read, I know maybe people are doing a lot of reading due to the pandemic, which is great. I have 3 books on the slide here that actually give you some tools on how to ask for what you need in your healthcare appointment. So the first one is called The Intelligent Patient's Guide to the Doctor-Patient Relationship. And so it's a fantastic book that can help give you some tools to help you continue to communicate even better with your healthcare team. The next book is called Surviving Modern Medicine, How to Get the Best from Doctors, Family, and Friends. So this is a great way to not only communicate well with your healthcare team, but also share what's going on with your health with loved ones, which I know that can be complicated and difficult to try to explain to your loved ones what's going on with your kidney disease, or if you're in dialysis, or if you've had a transplant. It can be hard to explain that to your family or friends, and so this is a book that can help you with that. And then this last book is called Making Informed Medical Decisions, which is great to help you make decisions with your health care, especially if you have a lot of specialists you have to see. It can be pretty stressful and overwhelming, so this is another really good book to think about looking into. So those are 3 resources I wanted to share with you, as well if you like to read, or if you know someone, if you have a friend or family member who you think would like any of these books, check these out. I'm sure you can probably find them at your public library if you want to check them out first before purchasing them. I always encourage my patients, if they have a library card, to check the book out first. If you like it, figure out if you want to buy it later. So with that, we have about 10 or so minutes left. I'll go through the chat box to see if people have any questions. My information is there on the slide. You're welcome to send me a message at any one of those places if you have any questions after this webinar. But I want to thank you all for your attention. I loved the activity in the chat box. This has been amazing that you all are so engaged. I very much appreciate that. But I wanted to open up time now for questions. So if you have questions, you can type them in the chat box, and I'll also go through if maybe people posted questions that I hadn't addressed yet. So I see a question. Someone says, I would say culture sometimes has an impact with how you address your healthcare providers. Yes, it absolutely does. Culture, language, both. And culture can be defined with so many different ways. There's a subculture of medicine that is very unique about being in a healthcare clinic that is different from any other setting that you can think of. And there's a culture there, and so it's understanding, okay, the nature of medicine and what that can look like too, can help, at least help you set some realistic expectations about what to expect during your healthcare visits once you understand, like, okay, I understand my provider's seeing a lot of patients today. I understand that I may only get a short amount of time. Okay, I understand that subculture. How could I still make use of my time? Because even though they have a full schedule, it's still your visit. You still have every right to ask the questions you want to ask. So how do you make the most of that time within the subculture of being in healthcare? So thank you for mentioning that in the chat box. So let me see what other questions we have. Yeah, oh, thank you. Pamela in the chat box. Thank you for mentioning this. She says, my mother, brother, and others have said they are afraid to ask questions for fear of making a doctor mad at them. I hear that a lot from patients of maybe why they didn't ask. But as we know, it is so important to ask your question because, again, it impacts your health, your loved one's health, their satisfaction with their health care. It makes a difference. And so I definitely want you or whoever it is to know that it's their care. It's your care. And you deserve every right to ask any question that you have. And so I know sometimes that can be overwhelming, and so I always encourage patients to start small. Maybe bring one question at a time to get in this new habit of asking a question. Because again, questions are there to just improve communication, provide clarification on something that is not clear. And again, when I asked the question earlier about people saying, how many of you leave your visits more confused than when you came in, so many people said yes. And if that's happening, we want to reduce that as much as possible. So it can be scary, and it's so important and valuable for your health care. And so just know that you have every right to ask any questions that you have. And I would encourage you to start with one at a time at each visit to help build your own confidence to know that you can do this and ask questions at your future healthcare visits. So thank you, Pamela, for mentioning that for sure. Someone says sometimes you don't know what to ask. Absolutely, especially if you have many different conditions going on. It can be really, really, really overwhelming. And so on the slide that I talked about, the patient list, I did give 2 examples of questions you can ask yourself if you're not sure where to start. So I would encourage you, let's see, Anne-Marie, you posted that, to take a look at that slide to help give you a place to start. And then the website that I shared, that should be on the DPC website shortly. If you click on that, it also gives you some ideas of questions to ask your healthcare team too if you're not sure where to start. But I hear you. That's something that a lot of people share, and so hopefully this will give you some ideas so you feel you have a good place to start at your next healthcare visit. So thank you so much for mentioning that. Any other questions that people have? I'm scrolling through to make sure I didn't miss anything in the chat box.
And this is Kathy. Andrea had a question in the chat box. She asked, are there resources to help both patients and providers with engaging in good communication when limited health literacy is the root cause?
Yes. So I hinted at that a little bit earlier about the coach care programs. Those programs can help, especially when there's low health literacy, low literacy period, if it's English as a second language, any of those or all of those issues. Coach care programs, patient advisory groups in your healthcare system, those groups and programs specifically can help when health literacy in general, or language is a barrier. These programs can help by giving you coaching, having someone accompany the patient to the visits to help make sure that things are addressed clearly. So I would definitely look into those programs to really help. And many healthcare systems have that because it impacts us everywhere, all over the country. And so if you have a loved one, or if it's you yourself that you fall into any of those descriptions that I shared, please look into that because that could definitely support you or your loved one and give them the help that they deserve. So thank you for bringing that up.
Stacy, I have one more question. It's not on in the chat box. When you talked about switching providers or changing doctors if it doesn't seem to be a good fit, would you encourage people to make sure that they've been accepted by a new physician or by a new dialysis center before they tell the old provider they're not going to stay with them or their physician, as opposed to just leaving somebody and not having a new person already lined up?
Yeah, I would definitely agree with that. I know sometimes, especially if you have a pretty negative experience with your healthcare team, we may want to impulsively say, forget it, I'm not coming back here, don't reschedule me, I'm done. And in the moment, it might feel really good to say that to someone that you feel is not listening to you. The long run is you're not necessarily getting any health care, which we definitely don't want that either. And so I would encourage you to, as it was mentioned, to look in your community to see, one, are there other options out there? And if there are, how can I begin that process of transitioning there? Because again, depending on where you are, there may not be options of transitioning somewhere else. So if there's not, we have to help you figure out, okay, if I'm going to be part of this dialysis center or of this healthcare center, how can I make this work so you're getting what you need? And so again, a lot of these tools we talked about today can help you get what you need, especially if you are going to stay in a system that maybe isn't your favorite, but at the end of the day, we want to make sure you're getting access to care, and how can we do that to where it's good care? And so I would absolutely agree with that. So thank you for pointing that out.
Well, I would like to thank you for being with us and sharing the hour with us, and all of the excellent information that you've provided. Very helpful. And I would like to encourage everyone to, speaking of feedback forms, which you mentioned earlier, to complete the feedback form that will come up on the computer at the end of this program. And just a few questions there that would be helpful to us. And please plan to join us for our next webinar, which will be on the basics of home dialysis. It will be on April 28th at 2 p.m. Eastern Time. So thank you, everyone, for joining us. And Stacy, thank you again for sharing all your information with us.
Thank you for having me. You all have a great rest of your day.
Right. Everyone stay safe and have a, as Stacy said, have a great day, and feel free to send us notes, and we will have this information up in the next week. Thank you, everyone.